All right. So we have short chapter 36, disaster preparedness and response. We do have a Quizlet. I will be sharing the Quizlet once we get closer, and I can put the link in there for you guys. And then we're going to wrap it all up. Okay. Now, again, we're getting closer and closer to the final. So as we go through the live session, these are questions I want you to be thinking about. Okay. What is the difference between an emergency and a disaster? Differentiating between a natural disaster and a human made disaster, and thinking about mitigation and looking at several examples of mitigation in a natural disaster. Okay. Think about these as we get through or as we go through this live session, which is chapter 36. Okay. Disaster preparedness and response. So, the first thing we have to identify are disasters. We have to look at common features of disasters and look at government agencies during a disaster. Okay. Um, and then explain the all hazard approach. In recent years, the focus on disaster preparedness has grown across a lot of different sectors, including healthcare. And that has to do to the increasing occurrence of natural disasters, pandemics, and other emergencies. For us, understanding disaster preparedness is going to be important because in times of crisis, healthcare facilities rely on all staff to respond effectively. This can mean that you will probably be assisting in emergency surgeries, getting sterile fields ready in conditions that are challenging, or even just supporting patient care in settings that may feel unusual, especially if the facility's capacity has been completely overwhelmed. So, to ensure allied health professionals are equipped, groups like KHEP, which is Commission of Accreditation of Allied Health Education Programs, have added disaster preparedness training to their accreditation standards for all ST programs. This just helps all of you when you become new STs at your hospitals. Um, that you have the education on emergency protocols and procedures, and it makes you just that much more of a valued member, especially in those times that things are going crazy. Okay. Our role is preparing surgical areas, maintaining sterile technique, assisting in surgical procedures. This all becomes even more important during emergencies because honestly, every second counts in saving lives. And I cannot stress that. So we have to understand the types of disasters. We look at what a disaster even means. Okay. This refers to a catastrophic event like a natural disaster, earthquakes, hurricanes, large scale accidents, plane crashes, and these are going to impact a wide area and pose risk to many lives. For us, these situations can lead to high patient influxes, requiring efficient preparation and being able to assist in a lot of different emergency surgeries. We look at an emergency. This is a smaller, more isolated event that affects a specific area, like a building fire or a multi car accident. While less widespread, an emergency still demands quick action and readiness from us as surgical techs who may need to assist in surgeries for the injured patients. And then there's the mass casualty event, or an MCE. This is a localized emergency where the number of casualties overwhelms local healthcare resources, such as during an active shooter or a train derailment. In these cases, of course, we're going to play a important role in setting up multiple sterile fields, assisting surgeons in high pressure environments, and then just helping manage supplies and equipment efficiently so that we can care for multiple patients rapidly. Now, each classification helps us to prepare for different scales of responses and just make sure that we're ready to act swiftly and effectively, whether the event is local or widespread. Which means we also have to know the levels of disaster. Okay. Level 1, local emergency. You may see these. Okay. This type is going to be managed by local emergency services without outside help. An example, a small building fire or a car accident. Okay. We may be asked to kind of help in the emergency surgeries or to help handle the increased patient load within the community healthcare system. With level 2, we look at regional assistance. Um, We may look for neighboring regions because the local resources aren't enough. This could include a major industrial accident or a natural disaster affecting multiple towns. Okay. And then with level 3, now we're talking about statewide and federal assistance. In a level 3 disaster, like a large earthquake or a severe hurricane, state and federal resources are mobilized to manage the scale of the crisis. We might work with federal response teams and participate in coordinate efforts to perform surgeries, maintain sterile environments, and really just have the availability to make sure that there are essential supplies, possibly even a makeshift or mobile hospital setting. Now, we talk about natural disasters. These are events caused by natural forces: hurricanes, tornadoes, earthquakes, floods, extreme temperatures. Natural disasters are still considered complex, especially in overcrowded areas where evacuations and medical responses become more difficult. We look at technological and accidental disasters. These disasters stem from accidents involving technology or human error, like chemical spills, industrial explosions, or power plant failures. We have pandemics versus epidemic. Now, a pandemic is a widespread infectious disease outbreak that affects large regions, crossing borders, and impacting multiple populations globally. Biggest example that we are also familiar with: COVID-19. In a pandemic, we may need to work with strict infection control protocols just to prevent the spread within healthcare facilities. Epidemic is an infectious disease outbreak that is limited to a specific population or region. For example, an influenza outbreak in a particular city is a epidemic. Okay. Now, we're still going to follow infection control procedures, but usually within a more localized setting. And then there's terrorist events, such as bombings or chemical attacks. They create high casualty events and often require a rapid, well coordinated response. Now, our role is going to be important in handling trauma surgeries, maintaining sterile environments, supporting emergency surgical teams. The all hazard approach, which is a strategy designed to prepare for any type of disaster, did gain significant attention after the events of September 11th, 9/11, and subsequent terrorist threats. Now, the approach ensured that even us, as surgical techs, are trained and equipped to handle a wide variety of disaster scenarios. which enabled us to respond effectively no matter the disaster type. Okay, so let's talk about some of the agencies. We look at FEMA, Federal Emergency Management Agency. They use the National Incident Management System, or NIMS, to organize and coordinate disaster response efforts across all sectors, including us in healthcare. NIMS provides a standardized framework with clear management structure, objectives, and defined chain of command, as well as procedures that are put into place that everyone involved knows what they're supposed to be doing and their responsibilities during a disaster. Now, for us, NIMS is important because it establishes how our healthcare facility will function in a coordinated way with other emergencies, different responders like the police, fire department, and government agencies. This means that in a disaster, we know exactly where we fit in the response plan, helping us to just ensure that there's some type of efficiency and effective patient care. At the local level, government and non-government agencies are going to work together to coordinate and respond to disasters. And this is to help the community make sure that they're prepared and supported during emergencies. Local government takes the lead in managing the situations, following protocols and guidelines provided by FEMA and EMA, which is the Emergency Management Agency. Okay. All right. So we've got 36.1. Now we get into the 4 phases of a disaster cycle. We're going to talk about documents. We're going to look at strategies. We're going to look at the incident command system. Talk about basic human needs. Look at primary components of healthcare facilities. There are ethical dilemmas that come up, but we have to again look at our role or our potential role in a disaster. Now, the disaster cycle. It is a structured framework that guides the action taken before, during, and after disasters just to help communities recover and return to some type of normal function. So we look at the 4 main phases. Again, 4 main phases. Mitigation. Now we're trying to reduce the impact of potential disasters, like improving building safety or setting up emergency plans. This may involve for us just going through reviewing to ensure that our surgical area is equipped for emergencies. Phase 2, preparedness. Now we're developing and practicing emergency response plans. We do drills in the operating room. Okay, we learn emergency preparedness, we learn emergency procedures, and we try to prepare for situations where surgical capacity may need to expand and expand quickly. All right. For example, at the Children's Hospital in SoCal, we had 16 operating rooms, right? But we also had some areas that could be used quickly if need be near the PACU. And we had a whole nother area where we had 4 more operating rooms. So we could go from 16 to 20 pretty fast. Okay. Number 3, response. The immediate action taken during a disaster, such as patient triage and emergency surgeries. This is where we are important. We're important in the whole thing. Okay, I'm being biased. We are the bomb. But anyways, surgical techs, we are essential because we're providing direct support in the operating room. We're looking at sterile fields. We're looking at our equipment. We're making sure that everything is ready. And we're used to being under high pressure conditions. Now, keep in mind, you're turning up the knob a little bit or a lot. Okay. Phase 4. Remember, there's 4. Recovery. The phase when communities rebuild and resume normal operations. or as normal as we can be, right? So we may assist with ongoing care for patients affected by the disaster, where we're ensuring that there's some type of continuity of surgical services as the facility, as the community start to recover. Now, the disaster cycle is a practical framework. It's going to help healthcare teams, especially us, organize our response and recovery efforts, ensuring that we are ready to act effectively throughout every stage of the disaster. Did that help break that down? Because you may see questions on the four phases. Okay, perfect. All right. Now, mitigation and response. In a disaster cycle, mitigation and response are two critical phases, each with a distinct role in managing disaster impact. And it's important that you know how to differentiate them. With mitigation, is risk reduction. This phase focuses on minimizing potential disaster risks before they actually happen. This could involve reinforcing, again, the infrastructure, developing safety protocols, looking at critical supplies, making sure they're available. For us, this means preparing operating rooms, making sure that we have secure storage for our sterile supplies, having backup power systems for surgical equipment, and implementing infection control measures just to prevent contamination during a disaster. With response, this is that immediate action phase when the disaster is happening. Your communities, they're working quickly to address urgent needs. We prioritize our needs. Healthcare providers, including the focusing on the most critical cases. Okay. We're looking at trauma. We're looking at life threatening injuries. We want to get those patients in first. We analyze the best use of our resources. Now, keep in mind that resources are often limited in a disaster. So, us as surgical techs, our surgical teams, we have to use materials. Okay. We have to use our staff and our space efficiently to care for as many patients as possible. So, we're going to be preparing multiple surgical kits, assisting in rapid patient turnover, and just making sure that each procedure uses only the necessary supplies. In major disasters, reducing the risk of morbidity, which is illness, and mortality, which is actually death, is a complex process aiming to bring down these risks to a level that communities can now kind of manage. Okay. How do we achieve this? Well, through humanitarian aid and skilled professionals who help affected areas survive and eventually recover. We have internal aid workers, often deployed by the United Nations or non governmental organizations. They'll come in, they'll bring in specialized skill support, local health services, and they all help to provide immediate relief. We look at FEMA and the CDC. Okay, they offer excellent resources for creating all hazard preparedness plans for individuals and families. The guides help people just prepare for a wide range of emergencies, from natural disasters to pandemics, making sure that they have the knowledge and the tools just to protect themselves and their loved ones. Okay. Being that preparedness is the first step, it's also the foundational step in planning for disaster. This phase involves just getting ready, having the mindset that at any time anything can happen, developing strategies and systems that will enable a community to respond effectively. So, here's how each aspect of preparedness comes into play. You have local team building. Okay. This is going to be important to form coordinated local teams that include healthcare professionals, emergency responders, and community leaders. This could mean us as surgical techs are collaborating with our surgeons, collaborating with our nurses and our emergency personnel just to make sure that everyone knows their role during a disaster. We have risk analysis that you see up there, right? That's the second one. It involves, let's look at potential hazards, whether it's natural or in the community. We're looking at earthquakes, we're looking at hurricanes, we're looking at technological, which is chemical spills, human made, could be terrorism. Okay. We look at our resources. This is going to be important because if you don't know what you have, how can you really be prepared? This is a crucial part. So we're looking at our medical supplies. We're looking at our equipment, making sure that it's still working. We're looking at our staff. Who do we have? Who can come in quick? And we're looking at our facilities. Then we have the actual plan itself, the detailed action plan that is going to outline how the community will respond to the disaster. It's going to have steps. It's going to have our communication. It's going to have our resource allocation. We're going to have our patient care located on there and our evacuation procedures because in some cases, that's all we can do is get our patients out. Okay. So as an ST, we have to understand the responses and the resources to help ensure a smooth transition to action, especially when disaster strikes. We look at the ICS, the Local Incident Command System. This is just a standardized framework used to organize and manage resources during disaster. This is where roles are identified, responsibilities are written out, and where you can find your actual communication lines. Again, we go back to coordination. All the teams, local hospitals, emergency medical services, law enforcement, community organizations, everyone has to work together. Now, in disaster preparedness, effective coordination and proper logistics is going to be important, right? Because we want everything to go smooth. We want it to be organized. We want it to be like a well-oiled machine. With that, all emergency response teams have to work together. This involves clear communication and a well-organized plan. We also have to manage our resources. We can't send all of our bandages to one section and then none to another. So we look at again those supplies, we look again at those equipments and our personnel, and we place them in the right places. Drills are big. Regular disaster drills help practice and refine the response plan. But it's also important for you as an individual and your family. In a disaster, personal safety is just as important as professional readiness. Having a plan for your family, just make sure that you can focus on your duties without worrying about your loved ones because they know what to do while you're not there. So, this includes evacuation routes, emergency contacts, and where to meet in case of a separation. I want you to think about something. Access to clean water is going to be important in any emergency. Having reliable source of drinking water, either through bottled water or a water filtration system, is going to be important for survival. Sometimes communication is going to fail. In a disaster, communication systems are going to fall down. So it's important to have alternate methods. Sometimes that means having two-way radios, satellite phones, or just everyone. This is our prearranged meeting point. Get there. Knowing how to evacuate safely and quickly is going to be key in certain disasters. Okay. Chapter talks about this ICS just a little bit more in detail. That standardized disaster management framework where coordination of responses, efforts are happening during the disaster, where there's that clear structure of organization where people are being directed and supported throughout the emergency. So let's break it down. Okay. The ICS, they come in, they ensure that all aspects of the disaster are addressed, from the patient care to the infrastructure support. We look at how disasters often require collaboration. Okay. Again, fire department, law enforcement, hospitals, and other emergency responders, they're all coming in. So, what does ICS do? They enable a unified system where different agencies can quickly start working together almost seamlessly. They focus on providing the necessary support to those on the front lines. For us, this might mean having immediate access to medical supplies, medical equipment, personnel on standby so that we can operate effectively and efficiently despite all the challenges that are posed by whatever disaster we are met with. Now, with so many different agencies and teams involved, ICS comes in and they ensure that tasks are clearly assigned, preventing overlapping efforts and wasted resources. Now, this is especially important in healthcare settings where surgical techs, we have to focus on our specific roles, knowing that other teams are addressing different areas of the response. A lot of times, we're in the operating room or in an operating room setting. Now, the ICS structure helps coordinate disaster response efforts, ensuring that everyone involved, from the surgical teams to the first responders, is organized, supported, and working towards the same goal. Now, in the aftermath of a disaster, we have to address human needs. That is going to be important to support the affected population and ensure recovery. So, you see some of the basic human needs on this particular slide, from providing safe temporary housing to evacuating people maybe from a danger zone. I think of Hurricane Katrina, um, to addressing mental health needs. Okay. Providing counseling, psychological first aid. This is going to be an important part of a disaster response. Communication, communication, communication. Effective communication is going to be important for anything, but especially when we're talking about coordinating disaster response efforts. So, healthcare facilities have to stay in contact with emergency services, local authorities, and other hospitals or clinics. We must be able to communicate with the surgical team and other medical staff about the status of patients, surgical needs, and available resources, ensuring that everyone is aligned and that resources are used effectively. You may be in a mass casualty. You started off with let's say an amputation, and you go straight from that case to, let's say, an IND, right? You're constantly moving. You may even have someone come in because you've been on your feet for 8 hours and you've got to break. So now you've got to talk to another team member to let them know this is where we're at in the case. Okay. We look at medical facility evacuation. In some disaster situation, healthcare facilities may need to evacuate the patient, or we may need to be evacuated just to ensure safety. This could be because of a structural damage, contamination, threats from the disaster itself. So let's say we're assisting in patient transfer. Okay. We may be providing medical care during the evacuation. You may be doing chest compressions. You could be ensuring that critical equipment is ready, instruments are ready, everything is safely transported to the new facility if needed. The chapter talks about surge capacity. Okay. This refers to a healthcare facility's ability to manage a sudden influx of patients, often overwhelming numbers. This can occur during a mass casualty incident, a pandemic, or a large scale disaster. So how does that affect us, right? We have to be prepared for an increased caseload. Let's say you work a normal shift and you're used to scrubbing maybe 3 or 4 cases. Now that 3 or 4 case may jump to 6 to 10 in that same period of time. Okay. Meaning you're working quickly and efficiently in high stress environments. This may also involve setting up additional operating rooms, sterilizing instruments on a tight timeline because we've got to get this turned over, and adapting to a rapidly changing condition. Once you guys get out there, you're going to even notice that from facility to facility is going to be different. For example, surgery centers tend to move a lot faster than hospitals. Hospitals versus a training hospital may also move slightly different. Whereas a training hospital, they take more time because they're training doctors, they're training nurses, surgical techs are also training, versus just a hospital that maybe does not have um, people they're training, right? So they may move a little bit faster. But surgery centers, they are moving fast. And if you like that type of fast pace, that may be where you're at because they're going. Okay. Now, with triage, this is the process of assessing and prioritizing patients based on severity of their injuries or their illnesses. In disaster situations, not all patients can be treated immediately. Um, so, healthcare professionals have to decide who will receive care first. Sometimes we are assisting in triage teams. We're preparing surgical areas for priority cases, those patients that are life threatening. And for those of you who are private military, it gets kind of triage for me sometimes gets confused because we do it kind of backwards in the military, right? So in the civilian sector, life threatening goes first. Like we got to get those in. The military, we do those that we can fix and get them back out in the field. That kind of makes, if that makes sense. So just a little bit different way that we do triage. Now, we're still looking at our instruments. We're still making sure our sterile fields are ready for immediate use and supporting operating room teams during high priority surgeries. But you see morgue up there, right? We have to talk about it. In large scale disasters, healthcare facilities often need to manage a morgue to handle deceased individuals. So, as a surgical tech, you may be asked to assist with postmortem care, helping with the body preparation, ensuring proper storage and handling of the deceased. We also ensure that infection control protocols are followed when managing the bodies and equipment. So, just something to kind of think about. We get to the point where there could be ethical dilemmas in disaster. We talk about invisibility of vulnerable populations, and I just saw that slide's a little bit blurry. Now, during a disaster, vulnerable populations such as the elderly, the poor, those with chronic illness, and individuals with impairments unfortunately often get overlooked. Why? They may not have access to the same immediate disaster relief resources as others and may not be able to evacuate or respond as quickly due to physical or social limitations. We have to think about how can we as healthcare providers and disaster management teams ensure that these groups are not forgotten. These are some of the ethical dilemmas that are brought up. We think about what specific resources or strategies could be put in place just to meet the needs. We as surgical techs, we're part of healthcare teams. We assist in identifying and providing care for vulnerable individuals. Now, these are all just questions that go into these ethical dilemmas. Okay. People who have immediate access to disaster assistance, such as those in urban areas or those that are close to emergency teams, they're going to often receive help first, right? Because it's just right there. While others, especially those in isolated or underfunded areas, may be left behind. Other ethical questions to be thinking about, right? We have to think, should all areas receive equal attention? Should resources be allocated based on the severity of the crisis in each location? But with that, how do we even ensure there's fair distribution of aid, particularly in situations where some groups do have more accessibility than others? Here's another issue. Individuals' perception of needs can vary greatly, and they may feel they need immediate medical care when others may need shelter, food, sanitation, just a little bit more urgently. So these are those questions that come up with that. How can disaster response teams, including us as STs, assess and prioritize true needs during a crisis? What systems can be put in place just to manage differing perceptions, but also make sure that resources are allocated effectively? We're not done. There's other dilemmas. We look at government compensation for disaster loss. But here's the issue. The question of whether the government should compensate individuals for disaster losses is both ethical and practical. Some may argue that individuals should be compensated for property damage, loss of livelihood, or health consequences, while others may view this as an undue burden and government resources. So here's some questions for this one. What criteria should be used to determine whether compensation is even appropriate? How can a balance be struck between helping those affected and managing limited resources? Let's talk about allocation, because this is another ethical dilemma. In a large scale disaster affecting multiple states or regions, decisions have to be made about where to allocate limited resources. I'm talking about medical supplies, I'm talking about personnel, and I'm talking about financial aid. This requires prioritization based on severity, accessibility, and population needs. So then we get to the questions, right? How should resources be distributed when multiple areas are affected? What criteria should be considered when we're deciding which region or population needs resources first? And then human behavior in disasters. This is one that's always tricky. I always go to movies when there's apocalypse and how we revert to different things, right? There's going to be fear. There's going to be people anxious. There may be even those that are depicted in those movies that are going around with the guns and taking all resources for themselves. Okay. Disasters can bring out both the best and unfortunately the worst in human behavior. Now, Some may demonstrate acts of heroism, right? Cooperation, kindness. Others are going to panic. They're going to hoard resources or act in ways that undermine collective efforts. So how can healthcare professionals, including us as surgical techs, manage the emotional and psychological reactions of individuals during a disaster? How can we contribute to maintaining a calm and cooperative environment? What strategies can be used to prevent negative behaviors such as hoarding or panic during critical situations? So you see the dilemmas, you see how the human psyche works, right? Does this kind of help bring it all together when we talk about ethical dilemmas and disasters, especially how it affects us as surgical techs? So I was trying to do it differently than just, here's the book, this is what the book says. So kind of like putting it into like, okay, here's some of the issues. And these are the questions. All right, awesome. Okay. We have to know our roles. Okay. So staff assignment in healthcare facilities are going to be important because there's got to be some type of coordination so that the response is efficient. We are often going to be based on our usual responsibilities because we're in the operating room. So most likely we're going to be in an operating room or surgical setting. And I said that particularly because oftentimes during these situations, you may be performing surgical duties in a different environment, but you're still in your role. Okay. Now, we may even be required to step outside of our normal scope of practice, and that's going to be depending on the need of the situation. All right, here's a breakdown. Okay. We have what's called a job action sheet. This is a standardized document that outlines specific duties and responsibilities for each staff member during a disaster. This just helps make sure that we all know what we're doing, we all know our role, and we all know our expectations. Now, this could include specific tasks like patient triage. Um, we have setting up equipment, maintaining sterile technique, the chain of command, and communicating protocols. Our usual role, of course, in the operating room during a disaster will generally be assigned our roles, which we know is going to be setting up our field, maintaining sterile technique, preparing our instruments, maintaining our sterile field, watching our sterile field, supporting our team during the procedure. But in a disaster situation, we may be required to perform duties outside of our scope of practice, like assisting with triage or patient transport or help managing non sterile procedures. And that's just going to depend on the disaster scale. We may also be tasked with managing resources like assisting with emergency medical supplies or taking on additional administrative roles just to support the emergency response. The activation of the emergency plan is one of the first events in any disaster response. I will repeat that. The activation of the emergency plan is one of the first events in the disaster response. Now, it usually includes staff call out protocols, ensuring that all necessary personnel are contacted and mobilized to provide care. Triage and assessment of needs, meaning looking at roles based on the most critical needs, which may require staff to work long hours or shift responsibilities as the situation unfolds. We, of course, are going to be part of the early response team, setting up additional operating rooms, looking at surgical spaces, just to handle increased demand for surgical care. Disease, unfortunately, often results in mass casualties or disasters, not disease. Disasters often result in mass casualties. So that means we're looking at immediate surgical interventions based on this increased need. Okay. So again, we're properly setting up our fields, our spaces, and looking at our instruments and our sterile supplies. Not too bad, but it was a lot to kind of break down. What questions do you have for me? So, if you have no questions, what I just put into the chat is the week 7 Quizlet. Okay, it breaks down. Let me show you guys what it. There are 50 concepts um, in this particular Quizlet that I want you guys to have as an additional resource as we get closer and closer to the final. As you know, as you'll see, you're going to get a lot of more different kind of ways to kind of break things down. Okay. We talked about disasters today. In 200 and then in 210, you saw me bring out more of the mini lessons into our actual live session. With that, if there is anything at all that you just want more clarification or you want me to kind of break it down, you guys let me know. We're at week 7. And as you know, it's going to be closer and closer and closer. Before you know it, we're going to be at finals. And so if there's any way that I can break things down just to make it click a little bit better or give you a different perspective, please, please, please let me know. For those of you who are watching this playback, I'm going to add the Quizlet link to the discussion forum so you'll be able to get it as well. With that, just like with 210, I have some questions for you for us to discuss in the discussion forum. How can surgical technologists balance their usual operating room duties with the unexpected demands of a disaster response? And what skills might be essential to adapt to the shift? And in a mass casualty event, how should resources be prioritized? And who should decide which patients receive immediate care versus delayed treatment? And I want you to think of the civilian side. I know I brought up what we had to do in the military, but I want you to think civilian, civilian, civilian. Okay. We talked a lot in chapter 36. Even though it was a short chapter, there was a lot that we did break down. Okay. We looked at concepts, we looked at different ways that we work in disaster environments. With that, I'm not going to keep you. I am humbled. Thank you guys for sticking this out. I know that these are longer live sessions, and I really do appreciate you being here with me. With that, you guys have a wonderful rest of your evening. Have a wonderful weekend. Be safe. And I look forward to everyone who can attend next week's live session. Good night, everybody.